Hello everyone, welcome to the next video that is under factors affecting oral drug absorption. There were three factors. We discussed biological factors, physicochemical properties of the drug, and the last factor is role of dosage form. What is dosage form? The drug in which form or the suitable or the acceptable form given, it is known as dosage form. Now the drug is made into some dosage form, either solution, suspension, tablet, capsule, or any dosage form which are suitable for administration to the patients are known as dosage forms. Now how this dosage forms affects the oral drug absorption? So the bioavailability is arranged in the decreasing order in case of dosage form. So the maximum bioavailability will be achieved for the solution dosage form, then for suspension and emulsion. This is in the decreasing order of bioavailability or oral absorption. Then capsules, then uncoated tablets, and last for coated tablets. So the oral absorption will be more for solution and less for coated tablets. So it is the decreasing order of the drugs oral absorption according to its role of dosage form. So first is solution. Solution dosage form, that is the drug is completely soluble in the dosage form. When the solution dosage forms will be preferred mainly in case of pediatric and geriatric patients, because children cannot administer the solid dosage form. They have difficulty in swallowing. Same with the case of geriatric patients. So in case of those patients who are pediatric and geriatric, solution dosage forms will be preferred. Children cannot be administered with some bitter kind of drugs or obnoxious drugs. So we can include sweetening agent, flavoring agent, coloring agent, and we can administer very easily to the children's. Solution also preferred in case of cough and cold preparation. In adults also, the cough syrups all will be available. Not the tablets will be preferred for cough preparation. Rather, solution dosage forms will be preferred for the cough and cold preparations. Now, what will be the rate limiting step in drug absorption when the drug is administered as solution dosage form? So, the main rate limiting step is gastric emptying. Since it is already in soluble form, it requires very less time to empty from the stomach to intestine. And if the drug is very absorbable in nature and its absorption is maximum in stomach, and the drugs will have less residence time left over for absorption, because gastric emptying time of the solution dosage form will be very less. Contrary in case of intestine, if the drug needs absorption in intestine and the drug immediately gets gastric emptied from stomach to intestine, its absorption will be faster and the rate will be also faster. So gastric emptying is the main factor which will affect the drug oral absorption when it is given in the form of solution dosage form. Now, whether all the drugs will be soluble, can we make all those drugs into a solution form? No, some drugs cannot be made into a solution because of its poor solubility. Then what we can do? We can go for other formulations, or otherwise if you need to prepare oral solutions, then we can go for inclusion of some co-solvents. You can use co-solvents to increase the solubility, or otherwise you can go for addition of wetting agents for increasing the solubility. So we can increase the solubility and then we can administer the drug in the form of solution. This is about the solution dosage form. Now next dosage form is the suspension dosage form. Suspension or emulsion, where the drug is not completely soluble. Here the drug is dispersed in an aqueous vehicle. So the main factor that or the rate limiting step in drug absorption in case of suspension is the solubility of the dispersed drug. Drug is not dissolved, drug is dispersed in the vehicle. So first of all, the drug which has been dispersed have to get soluble, then the drug have to be absorbed. So the rate limiting step in case of suspension dosage form is its solubility of the particles that are dispersed in the medium. So that is to be considered. Now what are the factors which are responsible for enhancing or inhibiting the oral drug absorption? So once it is the solubility of the formulation or the solubility of the drug which has been dispersed is concerned, so the particle size in which the particles are dispersed. So the particle size of the dispersed particles will be more important factor which may affect the oral absorption. Lesser the particle size, greater the surface area, more will be the dissolution of drugs. Then the crystalline nature of the drug. When you prepare suspension form, you have to consider the crystalline nature of the drug. Which form is more soluble form? So we have to go for the most soluble form. So the crystalline form is also to be considered in case of the suspension dosage form. And then inclusion of wetting agents. So we have to include some wetting agents in suspension formulation, as the dispersed phase is not soluble in nature. It has to at least spread or wet in the aqueous medium. To reduce the contact angle, we include wetting agent. This inclusion of wetting agents might also affect the oral absorption. Now the last factor is suspending agent added, or that mainly the viscosity of the suspension. These are all the factors to be considered in oral absorption of suspension dosage form. That is the particle size of the dispersed phase, crystalline nature of the dispersed particle, then inclusion of any wetting agents, and the viscosity of the suspension plays an important role. And what about emulsion? We can make oily solutions in case of solution form. In case of emulsion, we make a emulsified formulation out of oil and water, either oil and water or water in oil, to disperse the drug in liquid formulations. That also has the effect in oral drug absorption. Mainly inclusion of emulsifying agents and the viscosity of the formulation will affect the oral drug absorption when it is given in the form of emulsion. Now the next dosage form to be discussed is capsules. Capsules are where the drug is encapsulated in a shell. This may be hard or soft. That is, capsules may be of hard gelatin capsule shell or soft gelatin capsule cell. Inside this cell, in hard gelatin cell, mostly solid materials are encapsulated, whereas in case of soft gelatin cell, liquid or semi-solid kind of material will be entrapped in the soft gelatin capsule cell. However, these shell have to destruct in the GI fluids and then releases the drug for dissolution and hence absorption. So the destruction of this shell is the main factor which will affect the oral absorption. Also, inclusion of any diluents. We can't administer the capsule just with drug. So we have to include some diluents also. Diluents have to be mixed with the drug and has to be entrapped or encapsulated in the hard gelatin capsules. So the dissolution of the shell as well as the diluents which are added in the formulation, capsule formulation, will affect the oral drug absorption. How diluent have the effect in drug? Because its compatibility. There may be some compatibility issues that may arise when we use incompatible diluent with that of drug. Example, in case of tetracycline, Tetracycline should not be prepared along with the diluents like dicalcium phosphate or tricalcium phosphate. Already in effect of food I discussed this example that tetracycline cannot be administered or co-administered with milk. Why? Because the magnesium calcium content present in the milk may interact with the tetracycline. See, here the diluents of dicalcium phosphate, tricalcium phosphate also has calcium in its structure, which may have or which may prone to interact with tetracycline and make this tetracycline inactive and not absorbable in nature. That is why while selecting these diluents, we have to check the compatibility of that diluents with that of the drug that is to be used. So, the particle size of the drug, then selection of diluents also plays an important role in case of capsule drug absorption. Now, the next dosage form to be considered is tablet dosage form. Tablets. So, it is mainly uncoated tablets. These tablets can be either prepared by wet granulation method, dry granulation method or direct compression. So, we have different method. Either we make granules and then compress the tablet, or directly we mix all the ingredients and we compress into a tablet. So, the ingredients used in these formulations also may affect the drug dissolution and hence it affects the drug absorption. So, tablet is the formulation which is the formulation having reduced surface area. What we did in a tablet, for the purpose of swallowing, we reduce the surface area of the particle. If we need to ingest a powder, we have to take 1 scoop of powder or 2 scoop of powder. That may be more difficulty in swallowing in the point of patient view, whereas it will be having dose inaccuracy in the point of clinical view, as well as when we make a powder dosage forms, we may not have comfortable in administration as well as during formulation or packaging. So, the easier way to administer the powder dosage form is to reduce its surface area by by compressing into a tablet dosage form. Tablet dosage form is the reduced form of a powder form. So, we reduced its area and it is very easy to swallow. So, once you reduce the surface area, the solubility also will be affected, because this reduced tablet surface area have to be increased in surface area by making either into granules. They have to disintegrate first of all into granules or powders or deaggregates, and then this have to undergo the next step, that is dissolution. So, it directly doesn't involve in dissolution or absorption. It first of all have to break the tablet into powders or granules or some deaggregates. Then the increase in surface area, that is effective surface area, where exposed to the medium, then the drug will be dissolved and then absorbed. So, there are different steps in case of this tablet absorption. That is, tablet must undergo disintegration to have a particles, and then it must dissolve to become a solution, and then it have to absorb through the membrane to be in systemic circulation. So, the factors which influences the oral absorption of this tablet dosage form is disintegration and then in dissolution step. So, what all the factors? What is the gastric rate limiting step in case of tablet absorption? Is the dissolution. Disintegration also plays an important role in case of the oral absorption. The factors, what all the properties or the parameters that are going to affect this tablet's oral absorption are the binder, concentration and the type of binder used, diluents, like in capsules, the compatibility of the diluents, then lubricants, glidants, they must be used at a very low concentration, since they are hydrophobic in nature. Why we include lubricants in tablet dosage forms? To reduce the friction between the particle and the dye surface during compression. When you compress a powders in a compression machine with the help of dyes and punches, what happens? The powders may stick onto the surface of the dyes or punches. So to reduce the sticking nature, we have to include some lipophilic substances, that is known as lubricant. So lubricants are hydrophobic in nature. That's why they have to be used at very low concentration. If it is used at high concentration, they themselves will affect the dissolution of the formulation. Then of course the disintegrants, the type and the concentration. There are different types of disintegrants. Commonly used disintegrants are starch and pyrrolidone. There are super disintegrants, that is they disintegrate within 1 or 2 minutes at low concentration. Like example, cross-povidone, cross-cornulose, sodium starch glycolate, they are known as super disintegrants. So the disintegrant involvement also will affect, because this is also a step in the tablet absorption. So if you include super disintegrants, the tablet will be disintegrated faster, whereas the normal disintegrants or without disintegrant, the tablet's disintegration rate will be slower. So these are all the factors which will affect the drug absorption when the drug is given in the form of tablet dosage form. So the rate limiting step in case of tablet dosage form is its disintegration and dissolution. These both will limit the rate of drug absorption through oral route. Now the last dosage form in the category is the coated tablets. The tablets that are coated. Obviously we have barriers in the tablets. Tablet itself has limited oral bioavailability. When it is coated, we have another barrier to reduce the rate of dissolution. This coating may be of sugar coated or film coated, or it may be of enteric coated tablets. So film coating. What for film coating is done? It mostly doesn't affect the release rate of the drug, but film coating generally is done to improve the elegance of the formulation. If there are any roughness at the surface of particle or the tablet, that can be covered with the help of film coating, or otherwise we can provide a color to the formulation. Like the tablet formulation color may not be that much elegant, so to cover those inaccuracies or the appropriateness of the tablet, we can go for the film coating. Film coating generally done by cellulosic polymers. Cellulosic polymers that are of water soluble in nature. So the example for celluloses are methyl cellulose, HPMC, hydroxypropyl methyl cellulose, CMC, carboxymethyl cellulose, SCMC, sodium carboxymethyl cellulose, and ethyl cellulose. Except ethyl cellulose, all other cellulose are hydrophilic in nature. Only ethyl cellulose is lipophilic in nature, which is soluble in organic solvent. So any cellulosic material can be used for film coating purpose. So film coating purpose, which will be the rate limiting step of drug absorption? The film, anyway, it is not going to affect the rate of release, but it has least effect in the release rate, because there is a barrier, there will be effect in the release rate. So this will not have that much effect like uncoated tablet. Similar to that, this will have the release rate effect. Whereas the next coating is sugar coating. The sugar coating generally increase the weight of the tablet up to 50%. Increase in 50%. If you are preparing the tablet's weight of 100%, along with that 50% of the weight will be comprised of this sugar coated material, because it has 3 more coatings. That is, first of all, it has seal coating, then sub coating, finally sugar coating. This increase the weight of the sugar coated tablet. So first is seal coating. Generally, seal coating generally done to prevent the entry of moisture. So sealing can be done by some hydrophobic materials. So hydrophobic materials are used to do sealing in the tablet, like zinc, shellac, or the polymers which were used to perform the seal coating. So this seal coating protects the tablet from the external environment, mainly from the moisture. Next, subcoating is done. Subcoating can be done to round the edge of the tablet or to cover the imperfections that was in the subsequent coating. Then it has been coated with sugar coating. For ultimately, to mask the bitter taste of drug, generally sugar coating is done. So it has 3 more layers, and outermost layer will be of sugar coated layer, which will mask the bitter taste of the drug. So here we have so many layers which will affect the release rate of the drug. So here the rate limiting step or the factors which will affect the drug release is its seal coating. So since we had used hydrophobic substance like zinc and shellac for seal coating, it won't allow the moisture to enter, and also it has the chances that GI fluids cannot also enter, and it will affect the release rate. And lastly, enteric coated formulation. Now what is enteric coated formulation? This is coating of tablet with enteric polymers. So the enteric polymers example are PVP, phthalate, CMC, phthalate, HPMC, phthalate, then udrigid of grade S and L. Remember, S for small intestine, L for large intestine. It is not so, but just for remembering purpose, you just remember the grade of udrigid S and L, like intestine. Since enteric coated formulation releases the drug in intestine and bypasses the gastric environment. Matlab, the drug doesn't released in the gastric fluid and releases the drug in the intestine. When these enteric coated formulations are necessary, when you need the local action in intestine, say for example, if there is ulcer in intestine, why to release the drug in stomach? Not necessary. So you have to release the drug in intestine because it is going to cure the intestinal ulcer. So for the local action, we have to go for this enteric coating. Then when we have to go, if the drug is having narrow absorption window, what does it mean? Narrow absorption window matlab, the drug is absorbed only in part of GIT. That is, sometimes the drug will be absorbed only in stomach, or sometimes the drug will be absorbed only in intestine. In the case when the drug is absorbed only in intestine, why to release the drug in stomach? So in that case, we can go for enteric coated formulations. Then, if the drug causes gastric side effects, if the drug is having some adverse effects in gastric region, that is like gastric acidity, gastric bleeding, then why to release that? This will have a harsh environment. This will create a harsh environment because of the drug administered. So what we can do? We can protect the drug to be released in the gastric environment and to release only in the intestine. And for like example, aspirin. Aspirin has the issue of gastric bleeding. So the aspirin can be enteric coated and can be used to release the drug only in intestine. And lastly, when the drug is having maximum absorption in intestine, like vitamin B12. Vitamin B12 has the absorption rate maximum in intestine. That for that purpose also we can go for enteric coated formulation. So when we have local action in the intestine, when it causes gastric acidity, or if the drug is not stable in gastric region, then also like some penicillin drugs or the drugs which are stable in intestine but not in gastric media, for those drugs also we can go for the enteric coated formulation. So enteric coating, that is enteric polymers are used to coat the tablet. So what all the polymers used are like phthalates, CMC phthalate, HPMC phthalate, PVP phthalate, as well as udrigid of grade S and L can be used as enteric polymers. So what is the special about this enteric polymers? Why this drug is released only in intestine but not in stomach? How does this polymer knows? That is because of the pKa of the polymer. So all these polymer contains acidic groups, that is carboxylic group in its structure. We studied earlier in pH partition theory, acidic groups will be unionized in acidic medium. So, as the polymers are acidic in nature, in stomach they will be unionized. So, the coating around the tablet will not get solubilized because ionized form is soluble more. But here, as the polymer is acidic in nature, the pKa of the polymer is acidic in nature, they will be unionized in gastric pH. So they cannot dissolve as it is not ionized. So it is intact in the gastric region and it goes intact into the intestinal region, that is acidic polymer exposed to the alkaline medium. So acidic gets ionized in alkaline medium, which led to the salt dissolution of the enteric polymer. This leads to dissolving the enteric polymer. Now the film gets dissolved and the drug which has been coated inside, the core inside, has been released once the coating has dissolved. That is all about enteric polymers. So enteric polymers has acidic groups in their structure. That's why they don't release the drug in gastric medium and it releases the drug in the intestinal medium. Now what are the rate limiting steps in case of this enteric coated tablets are the pKa of the polymer. Which pKa? So if the pKa is nearer to, it have to be acidic. If it is nearer to the intestinal pH, sometimes they may get released in the acidic pH because sometimes the effect of food have effect on this release of drug from the enteric polymer. So the pKa of polymer is the most important factor for enteric coated formulation. And another rate limiting factor is that the gastric emptying of formulation. Since the drug is going to show its action, this enteric coated formulation also known as delayed release formulation. Why it is delayed release? Because it releases the drug only after it has been emptied from the stomach, and if the emptying is delayed, then the drug release in the intestine also will be delayed. On an average, we have gastric emptying time of 2 hours. So after 2 hours, the drug must be released in the intestine and must appear in the systemic circulation. But if the gastric emptying will be delayed, ultimately it will delay the release of drug and appearance of drug in the systemic circulation. So gastric emptying also plays an important role in oral absorption of enteric formulation. So there are two rate limiting factors which will affect the oral absorption of enteric coated tablet. That is, one is pKa of the polymer and another is gastric emptying. So here, in case of roll-out dosage form, we discussed with the different factors like solution, then the liquid dosage form itself, where solution form the drug is completely dissolved. When the drug is not dissolved but we have to make a liquid dosage form, then we go for the suspension and emulsion form. This is comparatively less oral absorption than that of this solution. And then next to that is emulsion. Emulsion also the liquid dosage form, and then next to this liquid dosage form we go for the solid dosage form, and in that it has not compressed, it has been dispersed when it is exposed to GI fluid, but the powder is encapsulated in the shell. Some capsule cell is used to protect the drug powder. So the capsule cell will affect the release of the drug. It not only protects the drug from the external environment, but also it affects the release of the drug from the GI environment. And next to the capsule, the powders are compressed or its surface area is reduced into a tablet. So while preparing tablet, the addition of diluents, lubricants, disintegrants, binders may affect the oral drug absorption. And then coated formulation, film coating, sugar coating and enteric coated. So film coating has less effect and it is similar to that of the release rate of uncoated tablet, whereas sugar coated seal coating will have more effect in the oral drug absorption, And in case of this enteric coated formulation, the pK of the enteric polymer which has been used and the gastric emptying time will affect the oral drug absorption. This is all about the factors affecting oral drug absorption. From the first classes, we were discussing about the oral drug absorption. Initially, we discussed about the mechanism of oral drug absorption. After that, we discussed about the different factors influencing the oral drug absorption. Among that, we discussed the biological factors, then the physicochemical properties of the drug, in that also solid and solution state, and lastly today we discussed about the role of dosage form. So what may be the important questions that can come in the oral drug absorption? So short notes may be from mechanism of drug absorption, or sometimes differentiate between passive and carrier mediated transport may be there, or sometimes notes on carrier mediated transport may be there. Sometimes the mechanism of action may also come in long answer. The factors influencing oral drug absorption, it is a lengthy process. So factors can be individually asked, like biological factors or physicochemical properties of the drug affecting drug absorption, or the last, role of dosage form. Sometimes inside the material, like pH partition theory can be asked. Sometimes even reasoning questions like effect of food, how the effect of food is going to influence the oral drug absorption, that may be also there. There are so many objective questions can come in this. So I have covered all those with the examples in my videos. And lastly, we have to discuss about the mechanism of non-peroral route of drug absorption. That is, these are all the factors according to oral route. But there are some route of drug administration that has been established, like non-peroral route. Apart from oral route, what other routes are available, like parenteral, nasal, ocular?